Hey, this is Carrie from Wrap Your Head Around Silks. This is the Expecting Aerialist podcast. It's where our aerial lifestyles intersect with motherhood and pregnancy. So glad to have you guys today. If you click on the show notes, there's a link to the free mini course by Wrap Your Head Around Silks. Really easy to register. Click there if you're interested. Today, I'm so excited to have Kaity Weichel. She is Canadian. She's an acupuncturist and a body worker, aerialist and a mama. And she's really a wonderful resource of information, and I love her story. Let's get to know Kaity. You do body work, you do acupuncture, am I right?
Yeah, I am a registered acupuncturist and a registered massage therapist.
Awesome. And you're also an aerialist and a studio owner. Is that true?
Yeah, that's true.
Oh my goodness. And you're in Saskatchewan in Canada.
Yes. Yeah. Middle of the prairie.
So what's the name of your studio?
Our studio is Fly Studios, YXE.
And what do you guys do there?
We do aerial silks, aerial sling, and lyra. We also have a hammock studio, so we do some low flow hammock fitness and restorative classes.
I am a body worker as well, so kind of like sisters in arms with that. But with acupuncture, I am like admittedly very uneducated in what it is, the purpose of it, the point of it, what kind of benefits you can get from it. And then I'd love to hear your birth stories and anything you want to tell me prenatal, postpartum, and then how it all intersects with aerial.
Well, I've been a registered massage therapist for 14 years, and I've been an acupuncturist for 11 years. The style of acupuncture I'm trained in is contemporary medical acupuncture. So I did my training out at McMaster University in Ontario for that. And it uses some traditional acupuncture points, but the main focus is neuromodulation of areas that have dysfunction. So we could be targeting trigger points in muscles. We could be working with scar tissue. We could be working with an area of muscle that is inhibited neurologically and trying to restore motor response in that area. So it has a number of targets that are a little bit outside of traditional acupuncture. And then the type of massage therapy I do is primarily instrument-assisted soft tissue mobilization, or IASTM. So I work with instruments, and again, targeting things like scar tissue and top bands within the muscle, removing restriction to try and restore full muscle length and strength and function.
Okay, I have a bunch of questions for you.
Sure.
Is this the type of instrumental work that is that considered Rolfing? I'm
not entirely familiar with Rolfing. I've heard of the name, but I don't know a lot about that.
Okay.
It's IASTM. We do a lot of frictions with an instrument that has a variety of edges. And each edge can kind of have a little bit of a different effect on muscle tissue or tendon. So we can break things apart that way. It has some precision edges for doing ischemic compressions to try and release trigger points. Yeah, it just allows a bit more precision and a bit more focused pressure that I wouldn't be able to sustain with the joints of my fingers or thumbs.
My question is, so it's to lubricate fascia, it's to break up scar tissue. I'm trying to compare it to my own body work method. I actually learned a Thai-based method, and it's based in thumbing. And then I have another method that I've learned from another practitioner that's more myofascia release of friction with knuckles and thumbs and forearms and elbows. So is it kind of in the same realm as that, except that you're using an instrument?
Yeah, it's pretty much the same. So I do use my elbow a lot as well, because as you know, elbow is a very handy tool for.
Oh, it is the best.
yeah, especially if you have a good pointy elbow.
I have been told that I have very pointy, mean elbows, and it's not said in a nice way at the moment. But then they keep on coming back. So
exactly. They like the results, right?
do you see, what kind of people do you end up seeing? Who are your client base?
I have a huge range of clients. I have patients who are elderly. I have lots of patients who just have repetitive strain through the jobs that they do or the posture that they're in for their work. And then I have some young athletes. So a huge range. I've worked on kids as well. Of course, they're easy to work on.
Kids are easy to work on because their fascia isn't so, stuck in its ways.
Their muscle releases so fast, and then, don't need much pressure.
Okay, so let's go into the acupuncture side. Assume that the listeners do not know what it is, why, how, the benefits, anything.
So it's the insertion of fine needles. They're very fine. They're almost the diameter of a hair. And they are not hollow, so they're a solid needle. You insert those at varying depths at specific points. A great example is with low back pain. I'd be assessing the patient, and likely their low back muscles are tight and their glutes are inhibited or weak and not responding as well as they could be. That's usually what we see. So I do a few insertions along the spine in the back muscles to try and release those. And I do a few deeper insertions in the upper glutes. And with the style of acupuncture I usually also run some current through the needles. So I'd hook up little alligator clips, and I have specialized devices that would run a bit of mild electrical current into the points.
Oh my goodness. Is that why have I never heard of that? Is that a part of acupuncture that's very basic?
Yeah, I think a lot of traditional acupuncturists will do that as well, depending on what their focus of treatment is.
Okay.
Yeah. So in that instance, I'd be looking to try and improve the motor response of the glutes. So we'd be looking for some contract and relax cycle to be happening with that electroacupuncture. And then you get more support for the low back from the glutes, which, as we know, I'm sure you know, are a lazy muscle that don't want to get involved in supporting our movements unless we make them.
Are you first and foremost trying to engage with the nervous system?
Yes.
With acupuncture? Is that the whole point?
Yeah, exactly. So it might be for motor function. It might be to neuromodulate pain of a sensitized area that was injured long ago and never fully recovered. So it can help reduce pain when the pain signal has become outside of what we consider normal. So it helps with that. And then you also, with the electrical current, you get some release of endorphins at the spinal cord level. So in my course, they refer to it as activating the body's internal pharmacy, the painkillers. So it can help with pain relief as well. Activating
the internal pharmacy. I've never heard that, and I think it's genius. I love that.
Pretty cool way of describing it.
Is it just experience, how exactly to know where you put these needles? Because it has to be so specific, right?
It is, yeah. We have to base our selection of points on targeting peripheral nervous system or targeting the muscles that run alongside the spine at specific spinal levels. So we might be targeting the nerve supply for an area at the spinal cord level. Of course, we're just inserting into muscle, not the spine itself. That would be a bad idea. And then we also do a few systemic points, which we draw from traditional acupuncture. So point in the top of the head is really great for overall pain relief. And then we do a few auricular points in the ears, also for pain relief. And then a few points near the wrists or ankles. Same goal with those as well.
Okay, so if you have never been to an acupuncturist and you're out there and you're listening, what would you expect from an entire session?
For someone who's considering acupuncture and has never tried it before?
Yeah, if I'd never been there before and I was just what am I supposed to expect? Do you put them in there and leave me on the table for an hour? What is...
Exactly, yeah. So with someone who's never tried it before, I try and only do a few points to start with to see how they respond to it, because the individual response can be very different from one person to the next. And yes, just talking and getting feedback from the patient as we go to make sure that they're feeling okay. And then if they're feeling great, then I'll step out of the room for 5 minutes to start with and check back in, and then leave them for a bit longer. And people really like that part. A lot of my patients fall asleep, or they say that they almost fall asleep. They're kind of somewhere between sleep and awake. And a lot of them feel a little bit lightheaded after treatment, but that passes within 5 to 10 minutes. A session is usually about 45 minutes to start.
Okay. And can kind of be meditative if you are in the right headspace.
Exactly. Yeah. I just have some white noise. I just have a fan going in the room. So it's very quiet, and they just kind of are left to relax into their treatment and to let their mind wander.
I actually need to do a lot of things. Ever since I had my Bean, she's going to be 2 tomorrow. Pretty much taking care of my body the way I used to kind of went by the wayside. So
hard to find time, hey?
Yeah, it's hard to find time, but I need to go do these things for myself. Okay, so let's talk about you as a mama. So can you tell us about anything you'd like to tell us about family planning, prenatal, your birth story? And you have 2, right?
I do have 2. I have 2 girls.
Yeah.
One is 7.5, and the other one is almost 5. Let me think. I guess I was 31 when I had my first one. It took me a long time to feel ready to have kids in life.
Yeah, like emotionally, financially, all the things.
Yeah. I mean, it's a little bit of a scary prospect, or maybe a very scary prospect, depending on who you are. And life is going to change completely.
Yeah. And, you sang that, but you had your first when you were 32, you said?
31. Yeah.
31. So you live in a different world than me, because had I said that at 31 here where I live, people would have been like that's what people say when they're 41 here. Does that make sense?
I'm not quite following.
Basically, we wait till we're almost infertile to have children in LA, because until we're freaking out because our bodies might not comply.
Gotcha.
So when you're saying that you waited, for me, because I live in a different world.
31 seems young for it.
Oh, yeah. But I have a business partner in Ohio where I grew up, and, her oldest is 21. My only is 2, so that was early, because she had her kids at like 23 years old.
Yeah. Very different worlds for her.
Yeah. Very different worlds that, depending on the community that you live in. But so you were feeling like it took you a little while to be ready for the next chapter, which it definitely is, because your life completely changes.
Yeah. You
utterly
feel like it spins itself inside out. And pregnancy was great for my first one. Just, awful heartburn, but that's pretty normal for people. And it was a very long labor for my first one. I was in active labor for 70 hours, which felt like an eternity.
Wait, active labor for 70 hours? That's like 3 days.
It was ridiculously long. Like contractions would
oh my God,
slow down and speed up, but they were always at regular intervals and pretty intense. But we went to the hospital 3 times because they wouldn't let us in the first 2 times. And then the 3rd time we went, it was the 50-hour mark. And I was like, please let me in. It's been 50 hours.
So how did you even rest? How did you even rest those first 2 days? Because if your contractions were coming every, I don't know.
We didn't. My husband and I were pretty much awake. By the time my daughter was born, we'd been awake for 90 hours, which was very difficult.
Oh my God. I always come on here. I'm like, it's going to be a regular story. No, every single story I listen to is bananas. What? This is crazy. Like, you have nothing left in you at that point.
It's pretty exhausted then. I did get an epidural at 60 hours, and that was amazing. I actually did get to sleep a little bit then on and off with that. So that was a little bit of a break.
Oh my God, you're a warrior. That's crazy. So they wouldn't let you in the hospital before you were dilated 5 centimeters. Is that the rule?
4 centimeters is their mark. Yeah.
4. Okay. Oh my goodness. And nobody, did they offer to induce you or no?
Well, I already had regular contractions. So no, they didn't really give me any options.
Okay. And you were like, I just want to have this baby.
Yeah, pretty much. You know how it is. You're in labor. You just want to get through it.
This bean was born 2 years ago tomorrow. And I remember 2 years ago today, I was like, I'm so done being pregnant.
Yes.
So done. And I didn't actually like being pregnant at all. So I was like, this is the longest 9 months of my life. So I can't even imagine. I had like a 30-hour process, but that's less than half.
That's still pretty long though. That's intense.
It's still pretty long, but oh my God, that's why my mouth is open, because I thought mine was long. I had an epidural way before you did. So
they're great though. Wow. If they work well for you.
Well, I had some issues with my epidural, but this is not my story. This is yours.
Yeah, so I can relate to what you said. I didn't like being pregnant either. I wanted to have my baby, but I did not enjoy the process of being pregnant. And I think it's amazing if women do enjoy that experience, but it definitely wasn't the case for me. And our baby was healthy. She had a very low APGAR score when she was born, just because her cord was wrapped around her ankle and they didn't know that till the last minute. I had a wonderful doctor for the delivery. She had to use the vacuum. At one point that malfunctioned and wouldn't turn off. So she yelled at the nurses. You had the vacuum assist? Yeah. And then the doctor was trying to turn it off. The machine wouldn't turn off. So she disengaged it and kicked it across the room. It was a little bit of intensity there, but we all got through it.
Wait, she couldn't turn it off after the baby was out? Yeah,
well, she was using it, and then she decided she was done with it. It wouldn't turn off. She yelled at the nurse to unplug it, and then she kicked it across the room. Which is kind of amazing. Funny. But you know how you're just not totally aware of what's going on at that point anyway, so.
Oh my God. Okay. That's a first for me to hear. Just a tangent. Do you have any pelvic floor issues because of that vacuum assist?
I didn't feel like I had pelvic floor issues. No, I didn't do any rehab after the first one, but I definitely did after the second one. My first baby was also quite intense. She had lots of reflux and issues with nursing. She had a tongue tie and a lip tie, so that was really difficult for her, and she wouldn't sleep. Her dad got desperate and read, Dr. Harvey Karp's 5 methods to get your baby to sleep. And we lived by those for a while, but it was a lot of sleeplessness. And it was hard to feel like I was doing anything right as a mom. If you have a baby who's not responding to the usual tricks, then you often question whether it's your skill or whether it's them or...
You know, my being is the same. I was beside myself trying to get her to sleep for maybe close to a year and a half.
Oh my goodness. Yeah. You end up with so much less sleep than you ever thought you could exist on, and into kind of a state of mind where you're like, I didn't even know it was possible to function like this, but still alive. So obviously it's going to work out. I honestly don't know how I existed and survived, because I remember saying to my girlfriends when I had my first 8 hours straight of sleep, like between the second trimester, because in the third trimester, I was so uncomfortable. I couldn't sleep through the night and I had to pee, right? Every time your bladder gets half full, you have to pee. Yeah. I think that I had my first 8-hour stretch at like 18 months of her life. That's a long time.
It's a long time. It's almost it's almost 2 full years of not sleeping for 8 hours in a row. I don't know how I survived because I am not the type that can go on a little sleep. Like I need 8 hours. If I don't have it, it's not good. So I feel you 100% because I don't even know how we survived. And when people ask me what I did, have you heard of that thing called the snoo?
No, I haven't.
Okay, it's like super expensive. I think it's like $1,500. It's like a bassinet, and then you strap the baby in, and it basically moves your baby when they start to fuss.
Oh, okay. So
and there's an app in your phone, but she hated it. She absolutely hated it. So we had every single sleep, and we didn't buy it. We borrowed it from a friend.
Mm-hmm. Well,
thank God, because every single little thing that I tried, I borrowed it from somebody because I would have gone broke. Yeah, so I totally feel you. So for you, how long is she a good sleeper now?
Oh, yeah. Actually, we used white noise all along, and both our girls sleep wonderfully. They sleep 10, 11 hours a night. It's crazy, actually. So
wow, that's great.
They're making up for it now.
Yeah. My Bean's making up for it too. She sleeps full 8 hours without waking up.
Oh, nice.
Yeah. Who knew? You know what I'm saying?
So I don't even understand. Yeah. And then you're good to go.
I have girlfriends. I have friends their kids were amazing sleepers for the first year. And then they started to shift. And those people, I feel bad for them because it's not like you ever, they got past they thought they got past the worst part. Mm-hmm. But I think dealing with the bad sleeper later on is even worse, honestly, because you're like, okay, the first year is supposed to be really hard. So I don't know.
Yeah, I think you're right about that. They don't know what they're in for, and then it takes them by surprise.
Yeah. Okay. So your first had acid reflux. So did ours. She had diaper rash the first couple weeks, and it was totally bad and it wouldn't go away. And that's partially why she was crying all the time. Yeah. I even joined this group on Facebook called, I think it was Fussy Babies. There's a Facebook group.
That's a good idea.
And it's just
support group.
Yeah. It was just moms commiserating because they just weren't sleeping. And I found that group and I was like, okay, I'm not alone. Because when some of your friends have those unicorn children, you're like, oh my God, right? Am I doing something wrong? So
having a high maintenance baby really, I think it made me have a fair bit of postpartum depression. It really felt like I'd just been kind of swallowed up by motherhood and wasn't sure really who I was anymore in all of that. So one day I was just on Facebook or whatever, and I saw some ad for aerial silks here in the city. I was like, oh, what's that? That looks really interesting. So I called the studio, which at the time was Move and Soar, owned by Yuki Block. And I said, can I just come and show up to a class? And they said, yeah, we've got a class tonight. Why don't you come to that? So I went and we did, a standard beginner class, and I was inverting on the knot, and I was like, this is amazing. I get to be upside down. This is so cool. And I just loved it and fell absolutely in love with it. And that really brought me out of what I had been feeling and gave me something new. And I just felt like a totally new person as a result of that. So I'm very attached to aerial because I feel like it saved me from the dark hole that I was in at the time.
Oh my goodness. Kaity, this story is amazing. I love this.
Oh, thanks.
Yeah. Well, I resonate with a lot of your story, but the aerial did not save my heart necessarily because I already had it in my life. And it's odd that that's true. You know what I'm saying? Because
yeah, you had a whole career.
Yeah. So what is it called? I had postpartum anxiety, which was just an elevated version of my, I already had anxiety, diagnosable anxiety beforehand. Mm-hmm. So, very little got me out of it except for medication because I don't know, like I already had those tools and they weren't working. You know what I'm saying?
Yeah, well, it's a whole new experience. The same tools might not work for that. And then if it's hormonal, then, there's only so much you can do about that.
Yeah. How long did you experience some PPD?
Well, I think like a lot of people, I had a lot of denial about it. But I'd say probably good 18 months.
Oh my goodness. That's a long time.
Yeah.
That's a really long time.
Once you know what to recognize, and I've seen this in other friends who have had babies. I've seen some friends for whom it seems like it's lasted, I don't know, 5 or 6 years even.
Oh my goodness. I feel like I got out a little lucky because, it's easier to recognize if you have something, if you've already had it. Mm-hmm. So my anxiety before, it was just a stronger version of it. So I knew I needed to go take care of it.
Yeah.
Your story reminds me of my friend Gail. Gail's been on the podcast before. She's my myofascia girl. Mm-hmm. When she was in the middle of her first pregnancy, she ended up with depression and it lasted like 2 or so years. And same thing, she met me, found Ariel, and she always tells me it brought her out of the cloud.
Ah, nice.
Yeah. And she always struck me as like, she's from Minnesota. She's very strong-willed and very grounded woman. And I think she didn't realize there was anything wrong because she was just like so tough, maybe. Mm-hmm. And so she went untreated for so long. She just had her second baby and her other child is now 9. And I would always ask her how she is. And she's like, I'm great because I'm not depressed. Like everything about this second pregnancy was just like so much easier because it wasn't the same as the first. So anyways, I resonate a lot with what you're talking about. Like, and I didn't even know, like Kaity, I knew like 4 things when I asked you on this podcast. This is amazing. So it lasted like 18 months. And so did you feel like Ariel just brought you out of the cloud and you kind of never went back into it?
Yeah, it really did. And then I trained for 9 months at the studio there and was loving it completely. And partway through that, we were trying for a second baby. So I knew that it was possible that I would be pregnant at some point. So I did get pregnant and I asked my instructor if I could keep training. And she said, well, I haven't worked with many pregnant women before, but you are an RMT, so you know what you're doing. So I'll trust you on that. And I was like, yeah, I'm good. So I trained until I was 5 months pregnant there. And then I started to get diastasis recti. So abs are separating. And my husband's also an RMT. So we just assessed that one day. I was like, I feel like it might be happening. And he's like, let's do this test. And he's like, oh, yes, it's happening. And I was like, dang, I think I should stop. So that was
RMT. What does that stand for, by the way?
Oh, sorry. Registered massage therapist.
Okay. Got it.
And we worked in the same clinic.
And how did you test that? Do you just test it with your fingers?
Yeah. Like you lay on your back. You can have knees bent and feet planted, and then you can palpate the midline around the umbilicus or the belly button. And then you just do an ab contraction. Like you try to lift your head and shoulders off of the floor, and normal abs will contract and stay relatively flat. And if you have diastasis, it will kind of dome up towards the midline. And that's a sign that the abs are separating there.
Okay, so you had a little bit of the DR. Most of us, what do they say? 100% of women have DR by the time the baby's born?
That would make sense. Yeah.
Yeah. So, but you had it earlier than the 3rd trimester.
Yeah. Well, it's second baby, and athletic women are more likely to get that as well. And so there are a few factors, but I think probably doing certain aerial moves longer than I should have contributed to that. But that was my decision and risk. So.
And you say athletic women are more at risk for DR just because we're using our abs more?
Yeah, because those stronger outer abdominal layers can actually work to sort of pull
apart.
Yeah, pull apart the inner layer.
Okay. All right. So you had a little DR, and how was the rest of the pregnancy?
It was fine. Just more of the same heartburn. Yeah.
Oh my God. Heartburn is really underrated. Terrible.
It's awful. I was on medication for that both times, and it just made a little bit of a dent in it. So, you start crossing food items off the list. You're like, I guess I won't eat that for months and months.
Yeah. I think that's really common. I had a little bit of heartburn the other day for no reason. I was like, this is terrible. And why did it happen? Yeah, totally terrible. So you had your second baby, and what was your journey postpartum?
I waited 6 weeks, and then I went to a pelvic floor specialist here in the city, a physiotherapist, and she was wonderful and gave me all kinds of exercises. So I went through physiotherapy rehab for that. It took longer than I wanted it to. I was so eager to get back to aerial classes. And so I went back pretty much a year after I had stopped, which was partway through that pregnancy. And I wasn't feeling like I was quite ready for full-on aerial classes. So I just joined the aerial fit and flex class. So it's more floor work and just using silks or hoop for some conditioning exercises.
Nice.
It's one of our intense classes, but yeah, there were definitely some moments in class where I wanted my abs to do something and they wouldn't. And I felt like I was on the verge of tears. But you persist and you get the strength back slowly, and dealing still, I think, with lots of hypermobility. As you know, when you're still nursing, there's still lots of hypermobility there, which affects strength and affects active flexibility and all of that.
And so you weren't an aerialist, or did you have any dance or gymnastics background before you walked into that class that day?
No, none.
Okay. So how's your path been with strength training and then flexibility training?
Pretty good. In Fly Studios, we do a lot of conditioning and flexibility work in our classes. We're kind of known for that in the city. Some of the other studios, I don't think they do as much. They just get on the silks pretty quickly. But we're trying to train strong, flexible aerialists. So that was part of Yuki's program when I was her student as well. And yeah, it's been decent. I feel like I've gained a lot of flexibility and strength.
Do you feel like when you first started, I remember the first time I started really stretching as a kid, because I was a dancer as a kid. I thought my muscles were going to rip. It was very, very, I can remember it like it was yesterday. So do you feel like your body was kind of open to it already, or was it really hard to start that process as an adult?
I don't think it was really hard. I mean, I wanted better flexibility than I had at the time when I started. I had done 5 years of taekwondo when I was a kid, so I was familiar with how stretching should feel. So it wasn't a surprise to try and push the length a little bit. Okay. I've got a lot of adults who have started as adults, and they're like, oh my goodness, this is such a challenge. But on the other hand, they're going to be in such in a better place when they're 80 years old, because if they had never done it, we all need to stretch. It's whether or not you're going to start or not. So absolutely. Yeah. I worked with all kinds of elderly patients who would have really benefited from strength and flexibility training earlier in life, and who definitely should have had pelvic floor rehab after their babies and didn't. You just see the long-term effects of that. And it's intense sometimes what they end up dealing with in their 70s and 80s. Yeah. And I think nothing's so static, but it's hard to reverse some of these things after it's been so long.
I had a moment where I was, when you go for like your car service and everybody's in a waiting room and it's like a breakfast scramble of humans. I forget how mobile I am.
Compared to the relative population.
Yes. Like I have a hip thing right now. My hip is like really aggravated. I got an x-ray on Friday just to check if there's something there. Probably get an MRI, going to see a chiropractor on Tuesday. So I feel in my body like 80 years old and totally broken right now. Right? That's how I characterize my feeling today. Mm-hmm. And then I walk into the car service thing to get my oil change. And I'm like, oh, Carrie, you're fine. Like, calm down, take it down a notch. You're fine. Like I'm so mobile and I'm so capable, but we don't always feel that way. But then you see yourself amongst just a regular population. You're like, wow.
Yeah, it's good to
we are a different bunch. Yeah, we're a different bunch. It's like we're talking about, you with 2 children, me with 1, getting back to full body inversions, somewhere between 6 weeks and 6 weeks after and 2 years after. And this to us is like the conversation. Like I literally had this conversation with the last podcast that I just recorded for like a half an hour, microing it. This is like what we talk about. So, yeah, so you went for that pelvic floor therapy and you are now 5 years out from your last pregnancy.
Yeah, just about.
Okay. Is there anything that is not what it was before when it comes to how it feels?
No, I'm definitely stronger now, but I would say that it's only within this past year that I've actually gotten my core strength to where I wanted it. And I'm sure it still could be better. But for the first 4 years after my second daughter was born, I would look at my training videos and I would just see my core was not in control of the movements and it was wobbly and it was unstable. And I could see that's where a lot of movement was being limited. So I think it did take an incredibly long time to rebuild that responsiveness in the core.
Yeah. And none of us want to hear that.
No,
like literally every single woman I've ever talked to when they're pregnant, they're like, yeah, I'm going to get back into the air exactly 6 weeks because that's what they tell you have to wait. And then I'm going to inversion train like a mad person until I have my inversion back. That's what every single woman says that I've ever talked to who's an aerialist.
But it's so easy to cheat the inversion, right? Like you can...
Yes. Yes.
You can definitely just muscle through it with hip flexors and quads and ignore your core entirely. So,
I mean, and getting the whole thing to function properly. And, you're talking about putting, hair-sized needles in people and stimulating nerves. Like it is, you have to heal. And it's not... like we should all chill out. I'm not even chilled out. The reason why my hip is in a bad place right now is I think I overtrained it. Mm. I think I talk about this every week. Kaity, you're gonna become a podcast listener. We're gonna indoctrinate you. And then if you decide to go back and listen to some of these episodes, you're gonna be like, Carrie, you talk about your inversions every week.
I think that's the thing about pelvic floor. It can be so sneaky. Like you can think that you're back to full strength, but it can be just not participating in the movement.
Yes, it is like,
but it's not.
No, it's definitely not. It's not participating. And I can feel that disconnection. So it is tricky and sneaky. And even physical therapists that I've talked to who are also aerialists that are on this podcast, they said the same thing. Like they just wanted to do it. So they just went and did it and kind of skipped some of the smaller steps. So 5 years out, you're feeling super strong. And you said 31, you were pregnant for the first time. Does that mean you're coming up on the big 40 soon?
I'm turning 39 in December.
Oh my goodness. So my math is almost correct. How do you feel about coming to this next, the dirty 40s?
I feel okay about it, actually. I guess I'll see what happens. I I feel like aerial helps keep you young, though.
Yeah.
I still get ID'd in liquor stores.
Yes.
I think that, if you have things in your life that keep you playful and tapping into, just being a human who's willing to be silly and have fun and fail at things and then enjoy things even if they're not going exactly how you want them, to let go of control. I think all of those things help contribute to keeping you youthful in many ways.
Yeah. And I always thought that motherhood would age me. And I feel like I don't necessarily think that's true. I don't think that's true anymore. I feel like my movement practice will keep me young for a really long time, at least on the inside, And then just strength wise, the bottom line of like pulling your own body weight constantly, it's, to me, it's always kept me in shape very easily.
Yeah, I don't think there's anything that compares quite to that.
Of course, if you do it in another fashion, CrossFit or whatever, it's the same idea. Like you're just pulling your body weight. I don't know if you teach beginners, but I teach beginners a couple times a week. It's not that it surprises me anymore, but just not being even able to pull themselves off the ground from like standing.
Yeah.
And I think to myself, I don't want to, but I can do a 15-minute atmosphere set if I need to, to support, yourself for that. But I could, and to be able to do some percentage of your weight for 15 minutes, you're a strong chick, which is super cool. It makes me happy.
I do teach beginners, and I love seeing how fast they progress.
Yeah.
Like even a few classes in, then they can hold themselves off the ground, and you see them working so hard, but they can do it.
Yeah. Oh, I want to come visit Canada sometime.
Well, you should come visit our beautiful new studio. We just opened our new location in June, because our previous location closed down in October of last year as a result of the pandemic. So.
Okay. But you guys were able to open back up in a different location. That's a big win.
We were. There were 3 of us instructors, Romy, Anastasia, and I, and we stepped forward and said, we'd really love to keep this going. Yuki actually moved to the States. She's in Tennessee, in Nashville now.
Okay. And she was the owner of the other studio? She really started
aerial arts in Saskatoon in a big way. Without her, it wouldn't be what it is in Saskatoon at all. And so she had run her studios for 7 years here in the city. And then she just needed to go and be with her husband in the States with everything that's happening in the pandemic. And so 3 of us said, yeah, we'd really like to keep this going because we can't live without it. So it took a lot of work, but we have our new studio.
Oh my goodness, that's amazing. And Canada as a whole has deep circus roots, like super deep.
Yeah, especially out in Montreal and BC.
Yeah. Do you feel like that influence carries over even to where you live?
Possibly. I'd love to see it carry over more if we ended up with people passing through. We'd always welcome instructors to come and train and teach us what they know. That would be pretty neat.
Yeah. I mean, Montreal is just like the hub. Yeah. Kaity, I learned some stuff today. And then also, you are perfect for this podcast. You may or may not know that.
Okay.
But your story fits right into this very, very small niche pocket, which is why I asked you to be on. Thanks so much to Kaity for being here today. Again, check out the show notes for the link to the free mini course by Wrap Your Head Around Silks. Thanks to Asa Watkins for music and post-production. And if you guys resonate with any of these stories, I would love to hear from you. Go ahead and leave a comment. And even if you'd like to be on the podcast, I want to reach you and all the corners of the world in our aerial community. So go ahead and connect with me there or at Carrie@wrapyourheadaroundsilks.com via email. All right, guys, thanks for being here. I will see you next time.